Hi, everyone. Sorry about that. Um, we're at session 10 of COVID-19 Colorado and beyond. Just want to make sure that I've got yes, I do have my speaker on. Um, so this webinar, as you know by now, is sponsored by the University of Colorado Denver's College of Liberal Arts and Sciences and its continuing and professional education and interdisciplinary studies programs. I'm Marjorie Levine Clark. I'm a professor of history and associate dean for diversity outreach and initiatives in the college, and I have been moderating this series. If you have questions, please use the Q&A feature at the bottom of your screen, and we hope to get to as many of your questions as we can at the end of the presentation. Information about student credit and continuing education units can be found on our continuing and professional education website. Students interested in credit have to write a one-page paper for every lecture, and today's prompt for the paper is, how would you respond to someone who says that COVID-19 outbreaks in meatpacking plants are due to the way the mostly immigrant workers live? What evidence could you provide that would indicate that they are structurally vulnerable? I'll say that again. I don't think I read it very well. How would you respond to someone who says that the COVID-19 outbreaks in meatpacking plants are due to the way the mostly immigrant workers live? What evidence could you provide that would indicate they are structurally vulnerable? Okay, so that prompt will be posted on the course website along with all the other questions. The lecture is also being recorded and it will be up on the website and the CLAS YouTube page as well. So we have lots of people to thank for making this webinar happen. First, Dean Pam Jansma and Assistant Dean Joanne Porter of the College of Liberal Arts and Sciences for supporting this program and making credit available to many of our students at no cost. Our outstanding faculty who volunteered their time for this series, Mike Effler and Noah Dodero from the Office of Information Technology, Shayna Bull, Amy Arnold, and the Office of Digital Education, Interim Associate Vice Chancellor of Academic Affairs, Joanne Brennan, the University Registrar, Carrie John, and her team, Associate Bursar, Eric Gray, and from the College of Liberal Arts and Sciences, we thank Tracy Combe, Director of Marketing and Communication, Laurel Dodds, Director of Continuing and Professional Education, Course and Curriculum Coordinator Mary Lovett, and Kristen Salisbury, Program Manager for Continuing and Professional Education, who oversaw putting this whole event together. So we're lucky today we have two presenters. Dr. Steve Koester is a professor of anthropology, retiring this year. Professor Koester, who received his PhD from the University of Colorado Boulder, studies health issues among marginalized populations. He has been a visiting behavioral scientist at the Centers for Disease Control and Prevention, the recipient of NIH grants, and a Fulbright research and teaching scholar at the Hanoi School of Public Health. His current work focuses on opioid overdose, homelessness, and a study examining the informal economy in St. Vincent and the Grenadines. Our second presenter is Dr. Don Stull, Professor Emeritus at the University of Kansas. Professor Stull also received his PhD from the University of Colorado Boulder. For the past 30 years, Professor Stull's work has focused on the meat and poultry industry in North America, rural industrialization and rapid growth communities, and industrial agriculture's impact on farmers, food processing workers, and rural communities. Professors Koester and Stull will be discussing why meatpacking plants became hotspots for COVID-19. Let's welcome Professors Koester and Stull.
Okay. Hi, everybody. I'm Steve Koester, and my colleague Don Stull, who I'm thrilled is here with me. I'm afraid I'm going to have to keep getting some water because I don't know, I'm losing my voice.
Yes, Steve, is there any way that you could increase your mic just a little bit?
To increase it,
Yeah.
um, let's see if I can. How's this? Is
That's
that
better.
better? Okay, great. Okay, thank you. Am I back on? Or
Go ahead.
oh, okay, okay. Well, okay. Sorry for that delay. Um, so I want to just begin by telling you that a primary focus of the anthropology department at CU Denver is medical anthropology, and and so we study human health and disease. We study it from a biosocial perspective. Looking at the interplay between biology and social factors. Um, I have outstanding colleagues, and I would urge you to check out our program. Um, Anthropologists probably are not the first people you might think about when it comes to a disease, but anthropologists have been intimately involved in understanding Ebola outbreaks, and in my case, HIV, AIDS, hepatitis, and overdose. In fact, we have several colleagues at the medical school. Um, because the COVID, and I'm going to be looking at my notes a little bit. I can't memorize because the COVID-19 pandemic is a global health crisis with far-reaching implications for all of us. Excuse me. Excuse me. I'm really losing my voice. I couldn't pass up this opportunity to try to contribute to CU Denver's class on COVID-19, even though I retired this May. And I naively decided to look at why so many workers in meatpacking plants throughout the country were becoming infected with COVID-19. Um, and what happened was I've spent the past month poring over articles, scholarly articles by people like Don Stahl, Michael Broadway, and Angela um, Stisa, I think is how she pronounces her name. Articles by investigative journalists like Jane Mayer, who has an article in this week's New Yorker on chicken processing plants, and both national and local news coverage, particularly local newspapers in the towns where these outbreaks have been occurring. And after doing all that, I realized that I was completely overwhelmed, and I was thinking to myself, oh, I should have stuck with thinking about this in terms of the homeless. But at any rate, I was very fortunate because Don Stahl is an incredibly kind person, and he agreed to do this lecture with me. And so, because of his graciousness, that's what we're going to do. And I want to say one more thing about Don that Marjorie didn't say, and it's a quote from his forthcoming article that I think all of you should have been able to download. And in that article, he says, "My work has taken me to towns and hamlets, farms and ranches, from Oklahoma to Alberta, and from Maryland to Manitoba. I have listened to packing house workers describe their work over beers and stood alongside them as they wielded knives and saws on kill floors and processing lines. I listened to them describe dismal working conditions and disabling injuries in courtrooms and living rooms." And I think that's something that you can't get from reading other people's work. That's what makes anthropology so unique. It's that participant observation, that's being there, getting to know people, and learning what their lives are like. And that's why we're so fortunate to have him join us. So, meatpacking plants, along with nursing homes and prisons, were, I think, the first hotspots for the COVID-19 outbreak, a pandemic in the United States. And the meatpacking industry, beef, pork, and poultry processing plants have experienced a large number of COVID outbreaks among their workers. Together, these companies employ over 500,000 people, and there are 30. It's phenomenal to me how huge this industry is, and yet how little we really know about it. But there are 35,000 processing plants in the United States, and again, almost 500,000 workers. COVID hotspots are located wherever the industry is located. Some of the major hotspots are in poultry plants in the South, pork processing plants in South Dakota, Iowa, and North Carolina, and beef slaughterhouses in the Midwest and West, including the JBS plant in Greeley and the Cargill plant in Fort Morgan. Let me see if I can show you some slides. Let me go back. So, yeah, as this slide shows you, over 16,000, there have been over 16,000 cases of COVID-19, people who have tested positive, who work in these facilities. And what's interesting about this is that these are statistics that CDC has collected from state health departments, but it only reports on 23 states. And that's because many states don't bother to collect the data, which is an interesting wrinkle that I think follows through what I've learned about this industry. Again, this hidden nature of it. But so a couple more things to say about that. One thing to say is that the Midwest Center for Investigative Reporting and USA Today, they did their own study, and they think that the numbers are much higher, more like 20,000 to 21,000 confirmed cases and over 91 deaths. And this was as of early June. So we would anticipate that there are more now. One of the reasons the account is much higher is, as I've said, the data is based on only 23 states. And this report and CDC's report did not include Delaware, Iowa, Mississippi, North Carolina, Ohio, or Texas, all states with a number of huge meat processing plants. So what does CDC say are the immediate causes of COVID-19 infection in meatpacking plants? And I think Don will get in this much more than I will, but let me just begin with this. So the immediate causes are, and from CDC's initial work, prolonged close workplace contact with coworkers for 8 to 12-hour shifts, shared workspaces, shared transportation to and from the workplace, congregate housing, and community contact with fellow workers. This is a chicken processing plant, and you can see how close the workers are to one another. Don will talk about what's called the line and how fast these workers have to work. Another feature that seems to be important in terms of COVID-19 transmission in meat processing plants is the work environment itself. Extreme temperatures, high levels of relative humidity, ventilation systems, blowers possibly moving contagious droplets through the air. And recent articles suggest that the coronavirus can stay aloft for hours in very tiny droplets of stagnant air, infecting people when they inhale. And then finally, one more feature that people talked about is noise. Workers have to lean into one another and yell out instructions. So one more photo of a plant. Okay, so, and this is a quote from a lawyer at the Southern Poverty Law Center. You can barely imagine a more perfect vector for this virus than an enclosed space where people are working very, very closely together and breathing the same air all day long with minimal protective equipment. Okay, I'm going to try to get my PowerPoint off of here. How do I? Sorry, I'm not sure how to move away from my PowerPoint. Can you?
Yes, just hit stop share.
Oh, thank you. Or if I can find it. Sorry. Okay. I'm sorry, I don't see stop. Oh wait, there, right in front of me. Okay, thank you. So. Because of these, hold on, I'm sorry, let me just look at my notes. So while the social and behavioral factors listed by CDC and features of meat processing plants' physical environment offer potential explanations for COVID transmission, they don't explain why the men and women who toil in this industry must work in such a high-risk environment. So to more fully understand these workers' vulnerability to COVID-19 requires that we look at the conditions under which they work, as well as the response of the companies and the government to these outbreaks in the meatpacking industry. As Dr. Stahl points out in his forthcoming article, the industry's singular emphasis is on hitting the numbers. And the final thing I want to say before we start our discussion, and I'm going to read this if you don't mind. Because of their extreme effects, disasters, and in this case, a global pandemic, often bring into view conditions that exacerbate certain people's susceptibility to harm, and in particular, social inequalities that might otherwise go unnoticed. Examples might include the suffering of the African American residents of New Orleans after Hurricane Katrina. And a classic is Eric Kleinenberg's social autopsy of Chicago's deadly 1995 heat wave, showing how racism, poverty, and social isolation were determining factors in the deaths of over 700 people. But in both cases, people suffered because of inequitable social arrangements that put them in harm's way. Paul Farmer, the anthropologist physician, considers these examples, and this is one of the concepts I'd like to see if we can get across. He considers these examples of structural violence, and I should, let me see if I can, actually, I'll show you a slide in a minute. Conditions that are embedded in the political and economic organization of our social world that have direct consequences on people's lives, their possibilities, their health, and their suffering. Examples include systemic racism, gender inequality, immigration policies, labor hierarchies, and unequal access to healthcare. Seemingly mundane policies or laws may also constitute forms of structural violence. In my case, working with people at risk for HIV and hepatitis and drug overdose, I focused in on how laws, how the criminal justice system made people more vulnerable to HIV, hepatitis, and drug overdose. Um, and and I think that these concepts, and I'm really glad I'm through with this introduction. I think that these theoretical concepts could be helpful in understanding why workers in slaughterhouses are at elevated risk for COVID-19. So with that, I'm going to have a sip of water, relax, and ask my colleague Don Stahl to tell us a little bit about working in these plants and what's behind CDC's 5 points of why people might be becoming infected.
Thanks, Steve, and thank you for inviting me. I always enjoy talking about meat and poultry, so I appreciate the kind introduction. I guess I should start by saying that in the late 19th century, meatpacking plants were the very first American workplaces to fragment tasks, to de-skill work, and to mechanically regulate output, productivity. And they did that by a continuous flow production process, what's called the chain or the line in meatpacking. And so the industry that Upton Sinclair described in his famous book, The Jungle, in 1906, was pioneered in the late 19th century in Cincinnati and Chicago. And it has continued to be a factory process. Meatpacking plants are really factories that disassemble animals, that convert animals into meat and poultry, and they are highly structured, very rigidly organized, and they are labor intensive, and they are factories where men and women and machines disassemble animals and turn them into meat. There are really three workforces in a meat or poultry plant. There's management, people that look like, largely like Steve and I, middle-aged, well, I'm not so middle-aged anymore, but middle-aged white men. And those are the managers, the cattle buyers, the salespersons, and so on. Then there's the office staff, clerical workers, computer techs, and so on. Those are largely white women. They may be spouses of the managers, or they may be local people from the local community. But 90% of the workers in a meat plant are line workers. They're hourly workers. They're out on the line. They are working on the kill floor or the processing floor or hives or other compartments. And they are the workers, and they are overwhelmingly people of color. Of those, they are predominantly immigrants, labor immigrants, or refugees. When I first started working in the meat industry back in the mid-'80s, they were largely immigrants from Mexico and elsewhere in Latin America, and from Southeast Asia, Vietnamese and Laotians. More recently, the new immigrant stream has come from Somalia, from Ethiopia, from Myanmar or Burma, and so those are the workers that are at greater risk for contracting COVID, and the ones who have been hardest hit. The first case of meatpacking workers being sick from COVID were the last week in March. By the last week in April, there were 5,000 meat and poultry workers infected, 20 dead. By May 7th, there were 12,000 meatpacking workers confirmed infected, 48 dead. As Steve points out, those numbers have continued to mushroom. And so once the infection reached meat and poultry plants, it just mushroomed. And as the CDC correctly, I think, indicated, the factors that cause meat and poultry plants to be hotspots are that people work in very close quarters, as those pictures on the screen indicated. Kill floors are hot, damp, bloody places. Processing floors are cold, damp, slippery places. Ventilation is poor. These plants are designed to really, they are self-contained. There are very few entry and exit points. They are very, very noisy. You really can't carry on a conversation. You have to yell in someone's ear or in their face. You have to read lips. That means that regulations about mask wearing are really don't work very well. Because if you want to communicate, you've got to take your earplugs out. You're supposed to wear hard hats and earplugs, but you can't really communicate if you've got those in. If you're going to yell to someone to communicate, or if you're going to read lips, you've got to take your mask down. People get very close together. Workers generally carpool to and from work, or they're bused by the company or by contractors that the company's hired, so they're traveling to and from work in groups. They enter and exit through, there's one doorway into the kill floor, there's one doorway into processing, and so they enter and exit through very limited entryways. When they go in, they then don their protective equipment, hard hats, smocks. Often they wear chainmail and other protective gear. So they put those on in locker rooms. They then go to lunch in relatively tight space. They go on breaks in tight spaces. And the other thing that the CDC doesn't talk about is that there is intense pressure on workers to work while they are sick, and to work while they are sick or injured. And the bonuses that companies instituted when COVID the first outbreaks occur, they were rewards for workers to work, to come to work. Some of the plants, including the JBS plant in Greeley, have raised wages. Those are further incentives to keep on working. And so workers will, the companies encourage them to work when they're sick. There's a culture of working when you're sick or injured. And those incentives, when you're making $13, $14 an hour, and you're getting a raise or you're getting a bonus, which is tied to attendance, those are going to be strong incentives for you to come to work.
Don, I have a question about that. Just in fact, at the Greeley plant, the Weld County health officials chastised the company for what they called a work while sick culture. And in fact, there were quotes from different workers saying, I told my supervisor I was sick, and they said, finish your shift, or you've got to come to work. And in fact, a lot of the work I read said that people are actually, there are points taken away if you miss work for being sick. Yeah. And what you said about the incentives, they do seem incredibly insidious at a time when people are at risk of catching a contagious disease. In other words, that you would encourage people to come to work. In the case of the Greeley plant, 5 pounds of ground beef was given to employees for coming, and then later on there were additional incentives.
Yes, and well, the Greeley plant just yesterday or the day before upped the hourly wage $1.85, which is great. I applaud that. Don't get me wrong.
Sure.
But it is an incentive for people to come to work. There were some companies when the outbreaks first occurred, and there was all this attention on TV news and so forth to the problems in meat plants. There were some companies that waived their penalties for staying home if you were sick or if you were sick. But those companies, Tyson, for example, did that. They have since walked that back, so you're no longer there's no longer, well, rephrase that. You are now once again penalized if for not showing up. There is a point system, usually 3 strikes and you're out. There is also this, it's not really written anywhere, but there is a strong, meatpacking plants are hyper masculine workplaces. And there is this strong culture of you work through injury or illness. It's part of that hyper masculine persona that meatpacking plants are characterized by. There's also a strong pressure from your supervisor. Each plant has a daily quota, the number of animals that they're supposed to slaughter and process. And plants are then in competition with other plants in the same company. You've got to hit your numbers for the day. So the pressure starts at the top from the plant manager. It goes to the floor managers. There's a manager for kill floor and processing and so on. Then the floor managers put pressure on the line supervisors. Each line has a supervisor, and that supervisor has a crew of 8, 10 people, whatever it is. So there's this pressure from corporate to the plant manager, to the floor manager, to the line supervisor, down to the line workers. We've got to hit our numbers. We've got to get this particular quota. There is, in fact, competition between different lines to do more than the other line that's doing the same thing you are. So there's this intense pressure to do the work, to get it out. And each line has a number of a set crewing. So there's so many workers that are supposed to be on that line to do that job at that line speed. And if people are absent for whatever reason, they're sick or they get fired or they just don't show up, then it's called short crewing. And if you're short crewed, the people that are on the line have to just work that much harder. And so that means it's called pulling your count. I have to get a certain product by my station at the speed with which the line works. So there's all this intense pressure. Some of it is overt, some of it is covert, some of it is self-induced, and there's this intense pressure, and companies have a number of ways in which they encourage attendance and discourage absence.
Well, one of the questions I have, actually several, but you mentioned these workers, primarily immigrant. I mean, I think of the 16,000 workers CDC said tested positive, 87% were minorities, and they're principally immigrants, some of whom are undocumented, and refugees. And so it would seem that these folks probably have a limited agency in terms of if they do get injured on the job. And again, my understanding is that meatpacking is one of the most dangerous occupations in the United States. And if you're injured on the job, the companies very often try not to pay, and I'm not even clear why, but they try not to pay workman's comp.
They don't. The injury and illness rate in meatpacking hit 44 per 100. That's 44 workers for every 100 in the early 90s. And since then it has come down. It's come down because there were a number of fines imposed by OSHA on companies. There was a movement toward better ergonomics, fitting the work to the worker. There were also some changes in the George W. Bush administration that redefined injuries. And so repetitive motion injuries, carpal tunnel, tennis elbow, and so on, the companies were no longer required to report those. And so the injury rates have come down dramatically. Some of that is, I think, a real decline. Some of it is some sleight of hand in terms of statistics. You know, there's lies, damned lies in statistics, and the statistics for injuries are often manipulated. Companies are notorious for underreporting illnesses. In a meatpacking plant, there is a nurse's station. There's one or more nurses on site. If you're injured or you're feeling sick, you go to the nurse. You would think that she would look at you, and if you're injured, send you home. But very often what she or he will do is patch you up and send you back on the floor, and discourage you from taking off. Companies also contract with physicians. They're not usually at the plant, but they're contracted. And so if you're injured, you'll be sent to the company physician. The company physician's main goal is to also get you back to work, or to minimize the level of injury. And if, you know, I spent 8 months going to workers' compensation hearings in Garden City, Kansas, listening to workers talk about their injuries. There is a huge pressure on workers to, even if they're injured, it's very difficult for them to be compensated. Workers' compensation laws have been greatly weakened in many states. And if you go in, you are going up against the company attorneys. It's very difficult to get compensated for injuries. And so there's all sorts of factors that keep you working. And if you're unable to work, that keep you, and if you're injured on the job, that keep you from getting adequately compensated for that injury.
You know, you mentioned, and this was astounding to me, the speed of the lines, and I don't think probably most of the people who are listening have any idea. So in Greeley at the JBS plant, 5,400 cattle a day are turned into steaks and ground beef, and at a pork plant, what is it? The one of many, but one in Marshalltown, Iowa, 21,000 hogs are turned into pork chops a day. Yeah. And I think in the way that they measure speed in poultry plants is birds per minute.
Yes, that's right. There are 3 shifts a day in a meat and poultry plant. There's the day shift, the night shift, and then there's the graveyard shift. They're usually called A, B, and C. Plants will run and kill and process animals for the A and B shift, which runs from roughly 7 in the morning to roughly midnight. The third shift is cleanup, and those are contract workers. They're not considered to be meatpacking workers, so injury rates among those workers are not counted against meatpacking. It's very, very dangerous. There's all sorts of water pressure, and it's just a very dangerous work. But 2 shifts a day, the Greeley plant kills 5,400 head. The Finney County plant in Garden City, Kansas, that I studied for many years, is 6,000 head a day. So that works out to be around 400 cattle an hour. It may be more or less depending on whether they do bone in or bone out, but it's roughly that. For hogs, it's roughly 1,000 hogs an hour. Hogs are smaller, they're more uniform, so you can go faster and process more animals. For chickens, it's between 150 and 200 birds a minute. You know, chickens are 5 or 6 pounds, they're uniform, so you can just zip them through. One of the things that happened, ironically, it's counterintuitive, but not if you really know the industry, is during the COVID, April, for example, when COVID was really hitting the plants hard, they were also asking for waivers of line speed. And so a number of waivers by the Food Safety and Inspection Service, the unit within the U.S. Department of Agriculture that controls that, was granting waivers allowing packing plants to run at higher and higher speeds. Now, those line speeds are what the government says you're supposed to do, but in fact, there's nobody really there, making sure that you follow that line speed. And so they'll run as fast as they can.
So the danger for the worker, increases with line speed, I would assume.
Absolutely. If you could do one thing to make it a safer place for workers, it would be to reduce line speed. It's not the only thing. Crewing is also really important. And other things, but that is the single most important contributing factor in terms of injury and illness in meatpacking.
Well, it's interesting that you mentioned these waivers during the the crisis, because it really makes me think of Naomi Klein's book, The Shock Doctrine, where she talks about disaster capitalism and the idea that in a crisis, that's the perfect opportunity to push forward on deregulating something or pushing for some sort of a policy change that otherwise might not go over. And I think we've seen that a lot with the crisis with environmental regulations. But increasing the line speeds, again, during a crisis like a viral infection in meatpacking plants seems again to be rather insidious.
The other thing too there were shortages in meat counters. I don't know in Colorado, but in a number of places there were reported that grocers were limiting the amount of meat that you could buy. Meat wasn't showing up. At the same time that was happening, and in late April, John Tyson, CEO of Tyson Foods, came out and said, if we don't do something, we're not going to have meat on the table. The next day, President Trump issued his executive order declaring poultry workers to be essential workers. In that month, there was a record amount of pork exported to China. So while there were shortages in U.S. meat, in meat counters and grocery stores, we were sending a record amount of pork to China. Now, coincidentally, Smithfield Foods is Chinese owned, and it's the largest pork processor in the U.S.
I'm looking at the time, and I had no idea that it was going so quickly. But because of my prompt for the students, one of the things I wanted to ask you about, or at least mention, was that we've become accustomed to hearing about the benefit, and we've just talked about this a little bit, but we've become accustomed to hearing about the benefits of deregulation, privatizing certain government functions. But it seems that in the case of the meatpacking industry, these kind of rule changes include a human cost as well. And it seems to me there have been a number of policies that have made jobs more difficult and the safety of the workers more tenuous. And again, this change in line speeds is one. And then another seems to be that, and this was reported in Bloomberg News, is that there's really no regulatory authority over these plants. CDC can make recommendations and provide guidelines, but OSHA, which is the regulating agency, has the power to regulate, has done very, very little.
OSHA has done virtually nothing. I don't know if it's still true now, but the last time I looked, there had been lots and lots and lots of complaints about worker safety related to COVID and elsewhere. OSHA had inspected only one plant. That was a plant in Dodge City, and that were 2 or 3 workers had died. This was a couple of months ago. The inspector came in, went to the workstations where those workers had worked, looked at them, left, and issued a clean bill of health. I mean, OSHA has been gutted, not just by the Trump administration, going back in previous administrations. It doesn't have enough personnel to really do its job. It has not done its job. It could fine, it has the authority to fine companies, but it has consistently issued relatively small fines. Those have often been negotiated down even farther, or they haven't done anything. What we have seen also, we've seen this waiver of line speed or increasing line speed. We've also seen a reduction in USDA inspectors who are supposed to ensure the safety of the workplace and also the safety of the meat and poultry that goes along those lines. If they see something wrong, they have the power to stop the chain. There's a lot of pressure on them not to do that, but they do have that power. So there has been a reduction, a shifting in meat inspection from USDA, the federal government, to the companies themselves. And that also it means that they are less likely to have someone who says, wait a minute, there's something amiss here. And that means that workers are at greater risk. It also means that consumers are at greater risk, because the likelihood, the faster the chain goes, the more likely there is to be some sort of slip up that will lead to tainting of the meat, letting fecal matter go down the line, puncturing intestines that lead to some sort of fecal matter getting on the animals and so forth. So there's a lot of, we should be very concerned as line speeds increase and as the number of USDA inspectors is reduced, that even if you don't care about the workers, you should be concerned about what that might mean for the quality of and the safety of the meat that you consume.
Well, I would hope that we would be concerned about the workers as well.
I would hope we would be too. But, Upton Sinclair famously said about his book, The Jungle, I aimed at America's heart and I hit it in its stomach. And he was more concerned about worker safety. The public read what he said about the tainted meat and all of the nasty stuff that went into their meat. And so that led to the Meat Inspection Act, the Food and Drug Act. Those are wonderful things, and thank goodness that we have them. But there wasn't a whole lot of reform in terms of labor. We also see this in the COVID, that the focus by the media and the general public concern came when the meat supply was being potentially threatened because of outbreaks of COVID. So all of a sudden we got concerned about the workers. Now, production is pretty much what it was a year ago. We've come back out of those shortages, and now production is more or less what it was. And we don't see so much concern about that anymore.
We could continue talking, or we can let people chat. I don't know what our moderator would like to do.
Why don't you do one more question between you two?
Okay. Well, let's see. Which one of my questions do I want to ask you then? Let's see. Now you put me on the spot. But
well, there was the question, I don't know what it's the test question, but the question people are supposed to write on is about the housing and so forth. And
well, that was one that I wanted to ask you about. Yes. In fact, where is that one? Yep, that's an important one, I think. What is the situation? Because one of CDC's concerns is what they call congregate housing, and I had to look up what that meant. But it means it means people living together that are not a nuclear family. So, but what is, the situation for worker housing in these communities, and do companies provide it, or is housing affordable? How do people survive?
well, the packers will tell you they're in the business of making meat. They're not in the business of providing housing or healthcare or other things, although they do provide insurance. So they may contract with landlords to provide housing and transportation for workers, but if they do, those costs are directly deducted from the workers' paychecks. And so very often workers will come home with virtually no money to spend because their housing and other costs have been deducted, as well as some companies are deducting the cost of the PPE. They're not supposed to, but they are taking those costs out of the workers' paychecks. You know, immigrants and other refugees and other economically struggling persons try to reduce their costs. And so their wages are low. They're often sending money home if they're an immigrant or refugee, sending money home to their family. So they very often live in cramped and substandard housing conditions. In communities like Garden City and Greeley, there are low-income housing is provided by trailer parks. So trailer parks may ring those communities, and so workers may live in those. Trailer parks are relatively cheap. You can own them. You can put as many people into those units as you want, whereas landlords may restrict the number of occupants. And packing house towns usually don't have well-developed housing codes, so that they very often have few, if any, housing codes. So that means there'll be a lot of slumlords and very substandard housing.
And again, the wages.
Refugees and immigrants also tend to live in ethnic enclaves.
Yeah.
And so those may be low-income apartment complexes or so on. You know, that's been true of immigrants since people began immigrating to the U.S. or elsewhere. A lot of people have blamed, meatpacking executives, government officials have blamed these outbreaks sort of on the culture of the people, on the culture of the immigrants or refugees. They're trying to really deflect blame and say these people are culturally different and therefore they're sort of bringing it on themselves. I mean, native-born meatpacking workers, of which there are many, are also find themselves living in substandard and crowded conditions as well. It's a function of the economic situation. There are a number of people who are not related, who are living together, single individuals or extended family members who are, because of the nature of their economic circumstance, they are trying to, you know, to make ends meet. College students do the same thing. And so I think there is certainly, you know, people do work for 8, 10, 12 hours a day, then they go into the community and they can catch the virus in the community as, you know, they're not necessarily catching it at work, although they may be, but they may not be.
Okay. Yeah, I thought it was one of the quotes I was going to use was the spokesperson for Smithfield Foods, who commenting on the outbreak at their pork processing plant in South Dakota, where 700 workers tested positive, explained that, quote, "It's hard to know what could have been done differently, given what she referred to as the plant's large immigrant population." She went on to say that, quote, "Living circumstances in certain cultures are different than they are with your traditional American family." Well, of course, that depends on whether or not you have the money to pay for your own home and your own apartment. But as you said, many of these immigrants are also sending remittances home. Yep. And so they're supporting families back where they came from.
Yes.
And again, the wages are $14, $15 an hour.
The wages are such that that most of these workers will qualify for free and reduced price lunches for, you know, if they have children going to public schools. So they are the working poor. I used to do volunteer work at a food pantry in Garden City, where when I was doing research there, and they would give out food boxes a couple of times a week, and I would help. Many of those workers, or many of the people who were coming to get food boxes, were workers at the Tyson plant. So the people that are processing our food don't make enough money to be able to feed themselves without assistance. And so it's,
Right.
it's
So I think I'm gonna come on now.
Okay.
And I wonder if this last point that you just made, that the people who are working to provide us with our food don't have enough money to buy their own, is an example of the structural violence that Steve brought up in the very beginning.
absolutely,
Would you say that's an example of what you were talking about?
absolutely.
Yeah. So this was really interesting and depressing, distressing. So I have some questions here. Do you think that the government can or will intervene to close any plants that are considered hotspots?
Um, it depends on what the questioner means by government. I don't think the federal government will. It is mandated that these are essential workers and the plants must remain open. And there has been a lot of pressure on that. A number of plants have closed for long weekends to do what they call deep cleaning. Some plants, like the Smithfield plant in Sioux Falls, like the Cargill, like the JBS plant in Greeley, have closed for 10 days, 2 weeks. But no, I don't. I think those plants will. They may shut down temporarily, but they won't close them.
Um, have company physicians been the ones seeing the COVID cases?
I can't answer that question. It's a great question. I don't know.
In some of the articles I read, people would go to probably they went to the nurses' station first, said they were feeling ill, but then when they really became sick, they ended up in urgent care, or yeah. So not so much the plant physicians.
Now, in sort of normal times, the companies, if you are injured in a plant, and you'll have to go to the company doctor. If you don't, um, you won't get compensated, and they won't recognize that you're injured and you need some sort of health care. I
Right,
don't I don't know that they're doing that in COVID. As
right.
I can't say.
Um, can you speak a little bit more on how immigrants and refugees are being scapegoated in regards to the spread of COVID-19?
Well, I think one of the reasons why we as a nation have not paid the attention that I believe we should to the circumstances of meat and poultry workers is because they are immigrants, refugees, people of color. They are the other, and we sort of turn a blind eye to them and just don't want to know about it. And I think um, that we see the same thing in terms of our views about them as they are coming down with COVID. They are certainly at greater risk for a variety of reasons that we've talked about. People of color have been hit hardest, I should say, in the COVID infections and fatalities. And I think I think we see that scapegoating in the statement that Steve read and other statements about these people are just different. They aren't they don't have their families aren't like traditional American families, whatever that might
Right.
mean.
One,
Um, and I think it's a roadblock to giving adequate attention to to the problem and to the needs of these particular populations.
I would agree. I mean, scapegoating is very effective. It's blaming the victim. And what I think we've tried to demonstrate here today is that there are these structural conditions that really need to change if workers' lives are going to be improved. But that's a whole different animal. No pun intended. But seriously, to change the industry would require fundamental economic changes, and it would cost the industry money.
But I mean, it seems to me the whole industry was designed to create hotspots, right? I mean, these structural problems, created, it was designed that way, right? I
It
mean,
seems like it.
systemically. Huh?
Yeah, well, they certainly seem to be the ideal, uh, the ideal they have the ideal conditions
Right.
for a virus, for a viral epidemic, for sure.
Right.
We,
If they're saying come to work when you're sick,
Yeah,
we're going to give you incentives to do so.
yeah.
Yeah. Don't.
we've also concentrated four companies, uh, three of whom are foreign owned, slaughter 85% of the cattle in America. Those same companies have control of the poultry. JBS is the number one protein producer in the world. It bought Pilgrim's Pride. So these few companies control our meat. So it's like they're the narrow part of the hourglass. We have producers, a lot of producers producing the animals. They come through a very, very few companies with a very few number of big, massive factories that process them, coming out to the millions of consumers. We've done that really since World War II, and mainly since, in terms of meatpacking, since 1960, when the industry moved out of the cities to get away from unionized labor, to get closer to its animals, to cut transportation costs, to get to right to work states. And so 50 companies, 50 plants slaughter 95% of the beef in America. And we've created this, and we need to fundamentally change the industry, and that's going to take a huge effort on the part of government and eaters as well.
So, Steve, what are you showing us
I
here?
wanted to just before we ended, I wanted to bring us back to the workers themselves, and that, and again, Don's point about, and the statistics of 87% of the people who have who have become positive with uh, um, COVID-19 in the meatpacking industry are immigrants and refugees. And so this is one of the 8 workers in Greeley who died, a 60-year-old grandmother who was a Burmese refugee. And this is just a shot, um, just to give a human face to this tragedy. And this is a photo of 6 of the uh, of the workers who died, and their places of origin. Um, uh, 4 of them, 3 of them being from Mexico. One, I'm not sure, it wasn't in his obituary, and 2 from Burma or Myanmar. But anyway, so I don't know if we have any other questions, but I didn't want to let that go.
Thank you for showing that. That's important that we see the faces of these people.
I'm muted. No, I think that's a good way to close this out. That we should remember the people who have been affected by this, and thinking about, not blaming the victim, but the conditions in which they work, right? Thinking about these systemic issues are really important. So thank you for this really useful conversation. And thank you for participating in the webinar. Next week, we have the mathematics and statistics of COVID-19. So that's what we'll be looking forward to on Monday, and we hope to see you then. So
Okay.
goodbye for now. Thank you.
Bye, everybody.